So I think my experiences with the LANAP protocol are a little bit different than other people's. I've had the LANAP protocol done on my own mouth on tooth number 14 and 15. And it was a world-changing experience for me. I've been interested in restoring tooth number 14 and 15 for quite some time. And in evaluating the area with my prosthodontist, it was determined there was a bit of recession on the palatal of both the 14 and 15, the roots. So I checked in with a periodontist to see whether or not a connective tissue graft or some kind of grafting procedure could help in the root coverage in that area. There was a moderate amount of recession, and the surgeon decided that it would be a good place to provide surgery and try to regain some gingival attachment. And in the process, I went through 2 surgeries, both of which were not successful, and resulted in a periodontal defect. Recognizing there was no periodontal disease in the area to begin with, just some recession. And I ended up with this periodontal defect on the palatal of both those roots that probed basically to the apex of both roots. And when I had that area evaluated by another periodontist, after extensive scaling root planing and reevaluating the area, it was determined that the teeth were not savable, that I was going to lose both those teeth, all for a little bit of extra gum tissue, which I was pretty upset about at the time. But during that period, which lasted about 2 years, it wasn't just the idea that I might lose those teeth, but it was also the incredible amount of discomfort I was in. I was living every day with pain in that particular area, both tooth sensitivity, because both those roots are vital, both those teeth are vital, but also discomfort from any kind of chewing and things like that. And then one morning, I literally woke up with this big aha. I mean, it had been some time, but I had been to a Millennium annual session some time back, and the LANAP procedure just kind of popped in my head, and I said, you know, I've got nothing to lose. I need to find a practitioner who has the laser. And coincidentally, both the other 2 periodontists that I had worked with didn't know anything about the procedure. So I found a local periodontist who was using the LANAP and who evaluated it, and quite frankly, was very clear and honest and said, you know, since this was not destruction due to periodontal disease, I can't give you an accurate prognosis. I don't know what's going to happen. All I know is that it's not going to hurt the situation. And I said, well, let's do it. The procedure was comfortable, and afterwards I was pretty upset. Now, I'm joking, but I was pretty upset. I was upset because it's very difficult for a dentist not to floss a particular area, and the LANAP procedure prevents me from flossing that area for quite some time, and you don't know how hard it is to stop your fingers from going to a place that they've been going to twice a day, you know, for so many years. So that was the hardest part, not flossing in the area. Then after the appropriate time of healing, the area was reevaluated, and believe it or not, I had attachment again. In fact, the probing depths were better than normal, and the discomfort had completely diminished, and I've literally saved those teeth. And it was unsavable, according to both periodontists, prior to the procedure. If you're a dentist thinking about including the Millennium laser into your practice, please do, because I really think that this is an amazing process, and the company does an incredible job of educating dentists on its use and making sure that they stay right on the cutting edge of the best use of the lasers. I think LANAP protocol works, absolutely, and it saved my 2 molars.